Preventing Opioid Use Disorder, presented by Kyle Graham, Heath Griffith, Taylor Tubertini, and Ryan Wall, targeted toward lawmakers and legislators. According to the CDC, in 2016, 11.5 million people self-reported personally misusing prescription opioids during the previous year. 62.3% reported the main reason for opioid misuse was because of physical pain, mainly lower back pain. 53% of misused opioids were obtained through a family or friend. In 2016, 2.1 million Americans had opioid use disorder, or OUD. OUD is classified in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, which is the diagnostic tool used by psychiatrists, as a problematic pattern of opioid use leading to clinically significant impairment or distress. Some of the signs and symptoms of OUD include craving of opioids, tolerance to opioids, and withdrawal from opioids all over a 12-month period. Physical therapists play an important role in preventing OUD and opioid misuse, as well as helping those who are already diagnosed with OUD. Lower back pain is one of the leading causes of opioid prescriptions, and physical therapists possess a vital set of skills to combat this type of pain without having to use opioids. Extensive research has been conducted on what type of physical therapy intervention best treats lower back pain, like the study conducted in 2009 by Rainville et al., which reviewed many research articles and compared each intervention used. They concluded that all of the interventions were effective in treating lower back pain, ranging from aerobic training, Pilates, and core strengthening exercises. These physical therapy interventions showcased an increase in function and decrease in pain. Combine this with the ability to emotionally connect to patients, allowing the therapist to get the best out of their patients, and opening a frank and honest dialogue about opioids. Physical therapists set up patients for success with meaningful education to empower their recovery.
So now that we've looked at what the role of a PT is in pain management, let's look at direct access, what it is, and why physical therapists push so hard for it. Direct access is the ability to see and be treated by a PT without the need of a physician's referral. And we push so hard to achieve this because it gives patients a frontline opportunity to address their pain in a more permanent way, all without ever touching a medication. Direct access for physical therapists has proven to be very efficient in prevention of OUD.
As you can see to the right of the screen, the chart shows the health insurance costs for Medicaid enrollees with an OUD. While the data stops in 2013, it is alarming at how much the cost has increased over 14 years. By allowing physical therapists to have direct access to patients, we can help reduce the state's economic burden involving patients with OUD. A systematic review by Oja et al. Compared physical therapy with direct access to referred physical therapy episodes of care. 8 studies were analyzed, and the results showed that healthcare costs were not greater in the direct access group, and in most cases the costs were less due to less ordered imaging and prescribed medications. Furthermore, patients who saw a physical therapist first were at a decreased risk of harm due to fewer side effects of medication and less exposure to imaging radiation. Additionally, patients who saw a physical therapist through direct access did not have more therapy visits or inferior health outcomes compared to those who were referred by a physician. Another study compared direct access states to provisional access states on healthcare utilization costs in patients with low back pain. The states that had provisional access had more healthcare costs due to more physician visits and more ordered imaging compared to those in direct access states. Ron et al. Performed a study comparing physical therapy versus opioid therapy and the downstream healthcare utilization, cost, and long-term opioid use following arthroscopic hip surgery. They found that patients who received physical therapy instead of opioids had a decreased risk for future hip surgeries, as well as less total future medical visits, which would ultimately lead to less total healthcare expenditures. They also found that patients who received physical therapy before beginning an opioid therapy had significantly less health care costs, and those patients were on an opioid prescription for a shorter amount of days than those that began an opioid therapy first. For those patients that began opioid therapy before physical therapy, they were more likely to have an additional arthroscopic hip surgery or total hip replacement in the future, which would therefore increase their overall health care expenditures in the future. Additionally, those receiving opioid therapy first had a significantly greater number of opioid prescriptions, as well as double the total number of days on an opioid prescription compared to physical therapy first group. And they were also more likely to have a chronic opioid use.
To sum this all up, we believe and evidence has shown that direct access for physical therapy can be a major solution to the opioid epidemic. With your help as legislators, approving direct access for PTs allows us to use the knowledge and expertise that we have to treat patients and find solutions prior to the introduction of medications. PT First results in decreased pain and a more permanent fix, decreased costs for the patients and the overall healthcare industry, and more importantly, increased quality of life, all without the risk of falling victim to OUD.